for me, I think it's a great opportunity for us to go, do you know what, it makes sense for us to work together in some things. I know we tend to have our own sort of ways of working locally, and that can be fine, but there might be some opportunities for us to go, let's put all our minds together and tackle something in one go. So let me give you an example. As a chief people officer, I tend to do with things to do with people, of course, and workforce. And one of the things I'm currently exploring is how do we help to recruit people internationally for both health and social care. And I know that there's gaps in the workforce, for example, mental health nursing, for example, social workers. And I can think of a way that actually, rather than having a recruitment team sitting in a council and one sitting in an NHS trust and one sitting somewhere else, why don't we just clump that together and think about a way of doing it that will benefit everybody and make the most of that sort of potential, that we can do it in a centralised way. So what I'd see and visualise that we do is instead of being in our own organisations, doing our own things and not being quite clear about what else is out there, because we're open with each other, because we're talking with each other all the time, we're gathering all of that intelligence, and then we're working together to get the right answers for our citizens, for our members of our community, for our patients. And what that will do is it will open up the opportunity for us to be more curious with each other, to ask the right questions of each other, to then think and bring in different thinking and diversity of opinions, and maybe then actually come up with innovative ideas that we wouldn't have done on our own. What we could do and what we should work on is how can we make BSW somewhere that's really attractive to any individual who wants to work in health and social care, and has then the opportunity to go, do you know what, I quite fancy being in the community as a nurse, but then after that I really wouldn't mind going into a hospital to do a little bit of a stint here, and thereafter I might just want to see what it's like to work in in a social care environment as well. And by so doing, if we can open up pathways where joining BSW means that you have the chance to have really great opportunities and weave your own career pathway across all these different organisations that exist in BSW, I think that would be an amazing opportunity. And I don't see why we wouldn't be able to create that. My impression is that we're behaving differently with each other. We've got a much more open frame of mind about how we're going to work together. And instead of concentrating on like the urgent and medical attention that we require for an individual, what we're doing is we're going, let's look at this in a wider lens, and let's think about this in terms of how we're going to ensure that the right thing is happening for the individual. So we don't keep people in a hospital for the sake of the fact that that's the easiest thing to do, is to send them in an ambulance to a hospital when they're unwell. Instead, we start going, okay, they're unwell, is there something we can do to keep them at home, to keep visiting them from a community perspective? And what I'm seeing is that the people that I'm coming across already are all trying to think in that different frame of mind. It's not about the organisation you work in and the way you've always done stuff. We're beginning to open up our lens to start saying we need to think about this differently, and people are all really keen to do that. There's a real desire to change, and I can already see that benefit.